The threat from more contagious variants of COVID-19 could change the rules for wearing face masks. Here to answer your questions is Dr. Todd Ellerin, Chief of Infectious Diseases at South Shore Health. Dr. Ellerin, always great to have you here. So we know the focus right now, that Delta variant, it's on track to become the dominant strain in the U.S. So far, the CDC says it's still safe for people, fully vaccinated people that is, to gather indoors and outdoors without masks. But now we're hearing the World Health Organization is urging everyone to continue wearing them consistently. So it's confusing, obviously. Should we wear the masks or shouldn't we?
It's confusing, Erica, but here's the difference. WHO has to think about the health of the world, really, right? Global safety. And you have to remember, 10 countries in the world have access to 75% of the vaccines. So there's this inequity there. So since most of the world is unvaccinated, that type of statement from the WHO does make sense, but it doesn't necessarily apply to the United States, given how well we're doing overall with vaccinations. Now remember, the US is a tapestry. So we're seeing the Delta variant actually not uniformly throughout the states, but it tends to be higher in areas that have less vaccine. So I think the key is for us to just keep vaccinating, get the word out, just knowing how effective these are.
All right, doctor, nice to see you as always. We have 3 COVID vaccines available here in the United States. We're talking about these variants. We keep hearing that Pfizer and Moderna protect against the Delta. We're hearing nothing about Johnson & Johnson. So how much protection do all of these offer against the variants, what we know so far?
Hi, Maria. So I think what's important to note is that the Pfizer vaccine has been shown in actual real-world experiences that it's been very effective. But with Moderna, we know it's a similar type of mRNA vaccine. It's also been shown to be very effective, but that's in the laboratory, okay? And with Johnson & Johnson, we're still learning more about this because the J&J vaccine hasn't been as widely distributed. Most of the data is going to be from the US. Now in South Africa, we are going to learn more about the J&J's vaccine. The likelihood is that all of the vaccines protect well against hospitalizations, but probably that 2-dose messenger RNA vaccines are going to be better at actually preventing infection because that second dose gives that real immune boost.
Well, speaking of that second dose, we know some people may have missed it, right? The Pfizer vaccine, Moderna vaccines, that second dose. So what's their risk right now from the variants? And will a second shot still boost immunity, even if it's really months past the deadline?
I'm glad you asked that, Erica. So what's really important to note is that second dose is really important because you get a huge boost in your neutralizing antibodies. Those are those key antibodies that target the virus and don't allow it to enter the cell. Now, after 1 dose, you're still likely protected against hospitalization, but we want people to go out and get that second dose, even if they're beyond that 6-week window. We know through countries like the United Kingdom who consistently are giving that second dose at about a 3-month interval window, that the body still gets a very good immune response. So the key is just going out and getting it. You don't have to start over, even if there's been months that have elapsed between the first and second dose.
I'm glad you asked that too, Erica. Thank you.
Well, thank you, Dr. Ellerin, as always.
Thanks,
Take
doctor.
care, guys.
Be well.